Welcome, everyone. Thank you so much for joining us in our first webinar of Future Directions Forum 2022. For those of you who have partaken in the forum's programming over the years, this is our sixth forum, and new this year. Rather than cramming all of our programming into 2 or 3 days, we decided to hold a monthly webinar series. We'll have a couple of events each month from now till the end of the year. And I'm very excited to have this as our first webinar series, in part because the content is near and dear to not only my heart, but the journal's heart as well. A couple of years ago, Chardée Galán reached out to me and asked me if the journal be willing to share a space on issues surrounding anti-racism in clinical science training. And over the course of a few weeks of discussion, we sort of landed on the idea that it might be really great to have this profiled as an editorial that came out early in 2021. I've heard, and I guess Cassie Boness and Chardée Galán, both of the presenters today, have heard from many of our colleagues that editorial quickly became required reading at many departments all over the country, interested in thinking about issues surrounding anti-racism with an idea of action, of moving towards actionable change. And so I was equally thrilled, not just that they wrote this fantastic editorial, but I was equally thrilled that they're willing to put together a workshop for this year's Future Directions Forum. And for those of you new to the Future Directions Forum, a sizable component of our programming involves providing guidance, particularly to early career researchers on all aspects of academic work. And so the issues we're thinking about today are not only paramount to providing equitable, diverse, just homes for trainees of all backgrounds, but it's also going to have a fantastic downstream effect on the quality of our science and our training. So without further ado, I'd like to hand the mics over to Chardée Galán, who's a professor at University of Southern California, and Cassie Boness, who's a professor at the University of New Mexico. Chardée, Cassie, the floor is yours.
Thank you, Anthony. Let me want to just start off with, while I'm getting this set up, we can start off with, you want to start off, Cassie, with just your...
Yeah, we were gonna just offer a brief statement of our positionality before we dive in today. So while Chardée is getting that set up, thank you for the intro, Andy. I'm Cassie Boness. I'm at the University of New Mexico and was a co-author on the original call to action that Andy referenced. It's nice to see many familiar faces and names today. Just briefly before we dive in, it's important to acknowledge our positionality and how we identify and kind of how that positions us relative to the work that we're going to talk about today and some of these topics more generally. So I personally identify as a queer, able-bodied, cisgender white woman. And I'm going to leave it at that and turn it over to Chardée.
Thank you, Cassie. So as I mentioned, or Andy mentioned, I'm an assistant professor in clinical psychology at the University of Southern California, and I identify as cisgender, heterosexual, able-bodied, first-generation college Mexican-American woman. So we can jump right into it. Just wanted to start off with an overview of today's workshop. We're going to start off with a, can everyone see this? Yeah, okay. With a brief self-reflection exercise, really just to encourage each of us to consider the different identities that we're bringing into this space. Next, we'll sort of provide a framework for understanding the ways in which the field of clinical science perpetuates racial oppression, disparities in mental health. I got a note in the chat that maybe it seems blurry. Does it seem blurry to other people? Does it look blurry to other people, more or less? I don't really know if it says my screen.
It appears pretty fine, Chardée. It's not too blurry.
Okay, I'm sorry.
Slightly blurry.
Yeah, so I'll provide a framework for understanding the ways in which the field of clinical science perpetuates racial oppression, disparities, and mental health outcomes. And in this discussion, sort of really highlight both the opportunity and the responsibility that graduate training programs have in interrupting this and engaging in structural reform. I'm going to keep that overview relatively short, around 10 to 15 minutes, so that the bulk of today can really be dedicated to, we want everyone to sort of break up into working groups, and each group will sort of be tasked with developing like concrete action plans for addressing some of the issues that I outlined in the introduction. So those are the working groups. We'll come back together after the working groups, sort of for a debrief about what each group talked about. And then we'll sort of conclude with each person sort of just developing a personalized action plan and just wrap up with another self-reflection. So I'm going to stop screen share. Do you want to go ahead and share the Jamboard and the self-reflection exercises, Cassie?
Yeah, I just put a link in the chat for those that are familiar with Jamboards. You can just follow that link and it will take you to what kind of looks like a PowerPoint slide. I'm also going to share my screen here. Are we seeing that okay? Okay, awesome. So we're going to start out with a couple of self-reflection questions. If you saw in the chat at the start here, there is a PDF that has been shared that is a participant guide. So you'll want to open that if you haven't already. We'll be using this throughout the workshop today. And the two questions that we're going to start out with for a bit of a self-reflection are also on that first page. So if you want to kind of follow along there as well. For those that are maybe less familiar with the Jamboard, it's important to click that link that I shared in the chat. And then what you can do in answering these questions is use this toolbar on the left, and you can add a sticky note kind of with whatever content you'd like. It does post anonymously, so we don't know who exactly is posting these. Please just share what you're comfortable sharing. There's no pressure here, of course, but everything you do share on here is anonymous. So we're just going to take 1 second here to respond to this first question, which is, what are my most salient social identities? Oh, is it
it's showing up on my end as view only.
Let's try editor. That would be why. Let's try again. Oh, that's not everyone. Okay, let's try that and see if that works. Does that allow everyone to click the sticky notes here and start to type? Okay, sorry about that. So again, we'll just take a minute or two to add some up here. You'll see me kind of moving them around. You can also move them around yourself if you prefer to do that. Okay. Non-US citizen, Chinese American, Latina, queer non-binary, Black man, child of immigrants, Asian American, first gen, Black woman. Lots of participation here. I like it. Thank you, everyone. Immigrant, highly educated, European male, rural background, lower SES upbringing, white Latino man, petite woman, first gen, couple first gens. Okay, Afro-Latina. Thank you so much to those sharing. This is fantastic. It's so nice to see such a diversity of identities represented here. I'm trying to move these around and talk at the same time. Okay, by social identities, do you mean aspects that are specific to social roles or any identities that may involve social relationships? I would say more generally, any identities that are salient to you as you kind of go about your day-to-day life. It could be racial identity, it could be SES, nationality, your relationship, like for example, I identify as a mother. Okay, we're gonna kind of keep what we're seeing here in mind and what you put here in mind. If you haven't had a chance to answer yet, that's okay. You can use that extra self-reflection space on the handout. We're gonna keep thinking about what we indicated here as our most salient social identities as we move on to the next question, which is, how do my race, ethnicity, and other aspects of my identity, such as sexual orientation, socioeconomic status, shape how I think, feel, and behave in workshops pertaining to anti-racism, such as this one? And again, you can use the Post-its on the side that seemed to work well last time. And we can just take a few minutes on this. Taking a more passive role, learning as a white person. Fantastic. Don't want to be a spokesperson for your racial group. Yeah. Fear of retaliation or legal consequences for speaking up. Feeling like the content may not be as geared towards you personally based on your identities. Gaining resources to help others, given your privilege. Cautious, more reflective as a white cisgendered person. These are fantastic. Keep them coming if you can. I feel a bit more comfortable because people in these spaces are willing to learn and engage in activism. Thinking about translating to action, especially in predominantly white spaces. Realizing that there are a lot of people of color here, wondering why there aren't more white people here. Great observation. A little worried that this type of activity or group is self-selective. Yeah. What else? These are really fantastic reflections. Thank you so much for being willing to share these. Excited to be humble and listen. This is great. Okay. Thank you so much to those of you that are sharing, that are taking the time to self-reflect on some of these things. If you haven't had a chance to share or don't feel comfortable sharing on the Jamboard, that's totally okay. And we would just encourage you to use that space in the participant guide to jot down a few thoughts as we continue to kind of move forward and what's planned for today. I'm gonna turn it back to Chardée.
All right, so now we're going to transition a little bit to the overview of today's workshop. So just a little bit of context. One of the things that we see is that despite significant improvements in our understanding of mental health, people of color continue to experience inequitable access to and utilization of mental health services. And so, for example, compared to non-Hispanic white individuals, people of color are less likely to seek out and receive mental health services. And then when they do receive services, they're more likely to receive inappropriate diagnoses, report lower levels of satisfaction with treatment, and are more likely to end services prematurely. And these persistent trends in mental health disparities, although they arise due to multiple factors, really underscore how important it is that we better prepare the next generation of clinical psychologists to really meet the needs of an increasingly racially and ethnically diverse population in the US. And so these disparities, combined with sort of the continued police shootings of several unarmed Black people and people of color more broadly, increases in racially motivated hate crimes and racist political rhetoric. It's sort of like these convergence of events that brought us together. We were all, I believe, graduate students at the time, and a couple postdocs, but sort of brought all of us came together to really begin envisioning how can we do a better job of addressing racial disparities, especially in mental health access and outcomes. The end product of these conversations was, as Andy mentioned, was this editorial in JCAP that served both as a call to action as well as a blueprint for dismantling institutionalized racism and inequities in clinical science. Oops, I'm going the wrong way here. And so in thinking through the types of structural reform that are needed, we really identified sort of two key modifiable factors that we see as sort of having downstream effects on the maintenance of racial inequities. The first really pertains to representation in our field. And so we know that despite the fact that our US population is becoming increasingly diverse, we really as a field haven't been able to keep pace with these demographic shifts in terms of our ability to recruit and retain psychologists of color who have been systematically excluded from the field of clinical science. And so we essentially have a mental health workforce that doesn't necessarily reflect the diversity of the broader population. There's certainly issues with this leaky pipeline metaphor. We don't have time to go into today, but I'm going to use it just because I think it's nice in terms of the visual, in terms of trying to underscore what the issues are here. So here what we see is that barriers to building a racially diverse workforce oftentimes take the form of leaks along the academic pipeline. So we see individuals of color are underrepresented at all levels, all academic levels. These disparities are certainly increasing along sort of each of these different connectors along the pipeline, from undergraduate to graduate school, all the way up to higher professional ranks. And one of the key components of this metaphor is the idea that simply focusing on recruiting more diverse students and faculty is not enough without intentional efforts on retention. And so, we ask ourselves, how do our programs contribute to these leaks in the pipeline? There are many ways, but there's sort of two key factors that we're really going to I'm going to emphasize right now are sort of experiences of racism and discrimination broadly, and also potentially specifically within our programs. And the other is sort of these experiences of sort of cultural taxation. These are sort of additional service obligations that oftentimes they call them sort of like invisible forms of labor. They're undervalued and sort of receive little or no recognition in terms of tenure promotion decisions, things like serving on diversity and equity inclusion committees, or mentoring undergraduate students of color. And so people have talked about the leaky pipeline in higher education broadly, but we were specifically interested in looking at this phenomena in clinical psych PhD programs. And so we did this anonymous online survey of graduate students and faculty in clinical psych PhD programs in the United States. And our goal here was to really assess perceptions of programs' efforts to recruit and retain graduate students and faculty of color, as well as experiences of racism and cultural taxation among students and faculty of color. And so we had representation from around 103 different institutions. And given the time constraints, I'm just going to highlight some of the key points. The first thing is that findings suggest that programs are making efforts to proactively recruit faculty and students of color. But what we see is that over half of students and faculty of color indicated that they have felt pressure to take on more service activities, things like committee assignments or diversity-related work because of their race compared to their white colleagues. We also see that approximately 75% indicated that they have seen and heard stereotypes about their own racial group in my program, and reported sort of generally decreased feelings of belongingness. And this is where, this is the part that I think gets especially concerning. We see that approximately a third of faculty and graduate students reported that they have, of color, indicated they have considered leaving their program because of racism that they've experienced, specifically within their program. And approximately 50% indicate that they have considered leaving academia entirely because of racism that they've experienced in the field. It's 50%. So I want to emphasize there's variability. Certainly some programs are doing better than others, but these findings really suggest that these high rates of cultural taxation and racial discrimination reported in this study really emphasize that simply admitting students, graduate students of color, or hiring faculty of color is really not the same as cultivating inclusive anti-racist climates. So we're not going to really, what do we do about this? We're not going to go into the solutions. I'm going to sort of leave that to everyone else during the working groups. But very broadly, we sort of, when we think about solutions, our broad goal should, how do we build systems to not only recruit, but also retain students and faculty of color? And this includes taking stock of how our programs may be communicating to scholars of color, but they're unwelcomed, and potentially contributing to decreased sense of belonging. So that's the first issue. The first issue pertains to representation. And the second issue that we sort of identified as having sort of these downstream effects on racial inequities are really sort of current approaches to training. We see that oftentimes trainees in clinical psychology, we continue to sort of treat and do research on with individuals and families of color without having foundational knowledge of how issues like institutionalized racism affect these communities, oftentimes without the skills to engage in cross-cultural interactions with cultural humility. We did a survey, I'm not going to go into the details of it, but we did a survey that really sort of emphasized how much of an issue this is. We see that we found approximately 75% of the students who were surveyed that we surveyed indicated that they are working with racial and ethnic minorities, but almost an equal percentage indicated that they've not received training actually in cultural humility. They've never actually received training in how to navigate or discuss experiences of racism and discrimination with clients. So really what we see is sort of this gap between what trainees need to develop cultural humility and to work with racially diverse populations and what they may actually be receiving from their respective programs. And again, all of this means, what this means is that many students are emerging from graduate programs feeling like they're not adequately prepared with the knowledge, awareness, and skills to provide culturally responsive care and to produce research that adequately meets the needs of our diverse country. And so all of this has downstream effects in terms of maintenance of inequities. And I like to present this just because I think that sometimes it can be very easy to focus on, hey, this is just what our program is doing. But when we begin to realize, hey, here are the intergenerational consequences, the downstream consequences of what we're doing or not doing within our programs, I think the importance of attending to training becomes very clear. So again, I'm going to leave the solutions part to you, but broadly, our goal is, we need to sort of begin to build systems to reform graduate training, clinical training, research training, teaching training, to really ensure that this next generation is sort of equipped to sort of meet these needs. So we're going to break up into working groups now. And I want to start before I get into this, I think one of the things, so for the next 40 minutes or so, we're going to be breaking up into these three different working groups. We're going to have one group that's going to be tasked with sort of recruitment and retention, sort of identifying concrete action plan for increasing recruitment and retention within our programs. The second group will be focused on clinical training. So how can we advance cultural humility and clinical training supervision? And the third will be focused on research training. So how can we improve training in racially and socially just research practices? Each of you were provided with a participant guide. I'm going to share screen quickly. So each of you were given sort of this participant guide. What we've done is that we have one page that's dedicated to each of the different working groups. So there's working group 1, focus on recruitment and retention. Working group 2, focused on advancing cultural humility and clinical training. And then working group 3, improving training racially and socially just research practices. Each of the handouts is formatted the same. So I'm just going to use this first one as a model. They all start off with like identifying the challenge. It's sort of like a summary of what I already said here, identifying sort of what we can do about it, a couple sentences about that. And then the next part are really the instruction. So you'll have around 40 minutes or so and sort of indicating here's what your working group is tasked with. It sort of elaborates on that a little bit. And then at the very bottom here, we have for groups that get stuck or sort of aren't really sure where to start, we have a couple of different tips here, guiding questions to sort of help guide you as you're sort of fleshing out your plans. Okay. I want to, before we do that, I just sort of want to give a couple of more tips and just take a couple of minutes to do that. And then we will break up into groups. Okay, so you're free to sort of structure this time as you want to here, but sort of a couple of things that would be helpful to do probably. First, if you don't know each other in the group, probably taking some time to briefly introduce yourselves. Maybe taking a couple of minutes to review the participant guide for your specific group. We're hoping that the bulk of the time can really be dedicated to sort of fleshing out your plans. And then just making sure, oops, what is going on here? What is, my computer's acting funny. Making sure that you give yourself a couple of minutes at the very end, maybe at least 2 minutes, to identify what are sort of the key solutions or takeaways that you really want to share with the rest of the group, because we'll be doing a debrief at the very end. The other piece that I sort of want to highlight is that, well, I think it's important to consider things like obstacles or challenges at this point. We don't want you to sort of be constrained by what you think is possible for our programs right now, right? So don't think like there's no way people in my program would ever get on board with something like this. I think our goal is to really sort of envision where is it that we should be at or moving towards. The other sort of point that I want to make is that, again, it's up to each group in terms of how you want to approach this, but our hope is that each group can sort of really work on fleshing out specifics as you sort of come up with your plans. So for example, rather than maybe talking about 10 different things that you could do in each of these 3 areas, maybe you would hone in on and thinking about maybe just 1 or 2 of them. I should have said this earlier. I don't know why I didn't, but people will be able to self-select into which of the 3 groups that they want to sort of participate in. So yeah, so rather than thinking about maybe 10 different solutions, maybe honing in on sort of like 1 or 2 of them. And the reason why I say this, I was telling Cassie, I think I personally get really frustrated with this feeling like we're having the same conversations over and over again about what needs to happen, but we're not really doing enough to really think about, how can we actually make things happen? So, one example that just to sort of, one example could be like if for example, your group says, hey, we really want to improve systems of accountability, really ensuring that faculty and graduate students are actually evaluated in their use of racially and socially just research practices. Then our hope would be that groups would sort of think about, okay, well, what would this actually look like? Who should students be evaluated by? Their graduate advisor, by the program more broadly? What would, if we were to develop specific research competencies pertaining to DEI and anti-racism, what would they be? Those are just some examples. I mean, each group is welcome to focus on whatever they want, but just to give you a sense as to like really trying to hone in on some of those details and fleshing out some plans. The final point that I'll make before we get into working groups is sort of this distinction between what I call performative and authentic change. When we think about authentic activism, performative wokeness or allyship, it's sort of this like superficially supporting a cause or an issue, but not really actually caring about the cause or really creating meaningful change, usually done to get attention or to avoid criticism. So a couple of examples that I like to use in terms of like performative change are, tokenism, right? So, we hire a person of color, and we emphasize the fact that we've hired this person as evidence of our program's commitment to DEI, right? Not really, so that would be an example of performative change. A couple of other examples would be, being resentful of having to do the work, maybe adding 1 or 2 DEI related articles to our classes to sort of check off boxes. And all of this is really in contrast to authentic change, right? Really embedding these principles into our culture, working to dismantle and challenge structural and interpersonal expressions of racism within our programs. Now, I know that everyone here, you're all committed to this, right? Because you're here. Right? Someone made a comment about people self-selecting. So I don't make this distinction to say, okay, out of concerns that folks are engaged in performative activism, but more so just to emphasize that I think even when we're well-intended, sometimes I think the solutions we identify can maybe end up being more surface level changes, right? That really don't move us towards embedding these principles into the core of who we are. So my hope is that like, just as your group is developing or identifying solutions, trying to think of like, are the solutions we're identifying more topical, like surface level structural surface level changes, or are there changes that are really going to sort of help create meaningful change within our program? And so just something to consider as you're going through and developing your plans. So I'm going to leave it at that. And I think we can, Cassie and I will be hopping into different groups during this time.
I just opened the breakout room, so everyone should be able to click breakout rooms at the bottom of your screen here, and then select which of the three. It looks like people are joining already. So which of the three, you just click join next to the title of the working group that you're interested in. So to reiterate, we have recruitment, clinical training and supervision, and research. Okay, it looks like everyone's back. Chardée, do you have slides for this that you wanted to pull up, or should we just jump in?
I think we can just jump right in. I think the way we were planning to structure this was that we'd have just sort of one representative from each group, maybe just take 2 or 3 minutes to talk about what their group discussed. And then after that, and so we're going to go one after the other, and then that way we'll have like ample time for sort of discussion.
Awesome. Thank you for sharing that. Group 3. We have yeah, go ahead, Chardée.
I was gonna say, so we were hoping for a discussion, but as always, like, time or opportunities for folks to comment on one another. And we have a little bit less time than we were hoping for. So we're actually thinking that what might be helpful is if you want to, I don't know if you want to direct them, Cassie, to like the participant guide. But I think one of the things I just sort of wanted to ask folks to do is to sort of just think about, like, based on the conversation here today, based off of everything that we talked about, either within your groups or the things that you heard right now, maybe just thinking about like one concrete thing that you feel like you can do to sort of take what we talked about and sort of put it into action. I think my sense is that everyone here is really committed to these issues because they are here. So I'm sure that you're already doing a lot of these things, but I know it can be really easy to get energized by from these conversations. And then, we go about our daily lives and it's sort of, sometimes we forget, oh, I actually, wanted to follow up on this, or I wanted to follow up on that. So just sort of being intentional in making, thinking about one concrete thing that we can sort of do or follow up on.
But thank you so much for being here and engaging in this activity with us. It's really great to have these conversations. And of course, there's never enough time. And we really encourage you to continue these conversations, particularly with your groups, whether that's putting your information in the Excel doc or connecting on Slack somehow, or maybe connecting with others in the group. So if you want to do that, we encourage you to do so. Otherwise, our contact information is on the participant guide. So if you want to follow up with us at any point, that's there. And otherwise, I'm going to hand it back to Andy.
Thank you so much, Chardée and Cassie, for leading a wonderful workshop. I hope you all got a lot out of it. And just a heads up, I'm going to upload, in case you all don't have it, I'm going to upload the schedule for the remainder of our programming for the year. We do have another workshop on the 26th on building a lab. So advice on building a lab. And then we have our first address on the 27th or the 26th. Let me go back and double check that, by Dr. Jessica Schleiter, who will be discussing issues relevant to building scalable interventions. So usually single session or just a few hours worth of delivery. And we hope to see you there. You all saw the registration link. So if for whatever reason you wanted to let us know that you were going to be attending more things than you thought you would, please let us know. But thank you all so much for your time.